everyone, it is your virtual sports chiropractor, Dr. Heather, and today I actually want to talk to my low back pain people. So guys, are you experiencing low back pain and not sure exactly if it's a strain, a disc injury, or maybe it's an inflammation? Well, you might be experiencing what's called sacroiliitis, and you might be going, oh my God, what the freak is that? I have no idea. Okay, well, that's what I want to talk to you guys about today, because some of us may be experiencing a condition called sacroiliitis, and I wanted to give you guys a better understanding of what it is before we really look at how you would go about using corrective exercise and some rehab techniques on how to really make that discomfort go away. So, like I said, this is what sacroiliitis is. So as you can see from the diagram here, we're looking at what's called our SI joints. That's where the pelvis meets the sacrum. So as you can see from this diagram being highlighted, it doesn't necessarily have to be running the whole entire line of the joint, but usually you're feeling some pain, some discomfort right where you see those dimples in, the backside of your body. So, if you're noticing that that's kind of where you want to put the ice and so forth, trying to stretch it out, trying to work out this area, you might be experiencing, like I said, a little bit more sacroiliitis. Now, from some other videos you may have seen where I talk about, what is this? Well, again, because if we look at the word, it is an irritation. It's an inflammation to our sacroiliac joint. Okay, that's where the sacrum meets the ilium. And again, just like you saw in that other picture, that's where the discomfort would be. And a lot of times, people who do suffer with low back pain may be having more of a sacroiliitis issue, because you could also be experiencing a little bit of discomfort towards the buttocks area. Now, granted, yes, you could be experiencing pain down one leg or both. You're noticing the discomfort a little bit more with standing, or, you have to take the stairs at work, or you're in an apartment building and you're noticing just going up and down the stairs, each step is just kind of aggravating it a little bit further. That might be a sacroiliitis issue. Now, if you're unsure if it really is a sacroiliitis issue, I would highly recommend book that consult with me. Let's kind of get a better understanding of what's going on, what created the issue, what you've tried, and then how to really proceed a little bit further. Because this is just a general overview. So please understand that we're just kind of talking about the actual injury and what it is, so you guys can just start to determine, do I have this condition, or has another doctor actually mentioned that I have sacroiliitis? Now, a lot of times sacroiliitis will be diagnosed by either a PT, a chiropractor like myself, or an osteopath. Generally, a general practitioner isn't going to really state that you have sacroiliitis. They won't get that specific, but they may just say, okay, you have some back pain. Now, what happens here is, like I said, the SI joint gets irritated, it becomes inflamed, and a lot of times this can be linked to degenerative conditions. So if you already know that you're prone to some type of degenerative joint disease, meaning that you're noticing that, the lumbar spine is starting to have that degenerative effect, where you're just seeing kind of more, not really healthy bone, but noticing like some more calcification coming into the area, this is where a sacroiliitis might be more prevalent, where you might be seeing it a little bit more. If you do have like a facet syndrome issue going on, if you are more prone to arthritis, osteoarthritis, maybe a spondylolisthesis, some of the other conditions that you would normally go see a chiropractor for, you might be prone to having a sacroiliitis issue in your low back area. Now, usually the treatment protocol when this happens is really some type of pain reliever. So it's obviously to use ice, it's to use some soft tissue, but usually the doctor is going to recommend that you take something because it's such a heavy inflammation area. Now, again, as I've said before in other videos, if you do choose to take the, anti-inflammatory, make sure you double check with your physician, your pharmacist, especially if you have any other medications that you're taking that may actually counter or not be the right fit, in the sense of you're just noticing that it would not be wise to take that anti-inflammatory or muscle relaxant with some other type of medication. So do just take a look at that. Definitely ask your physician about that. Now, I'm very big on core exercises, and core exercises are actually a great treatment protocol for sacroiliitis. But that's after the initial phase. So that's after the inflammation really has gone down and you feel like you can actually start to work the core a little bit more. Because what's going to happen is the more that you can start working the core, the deep pelvic floor muscles, the spinal stabilizers, the transverse abdominis muscle, you're going to notice that, your sacroiliitis is not going to flare up as much. It doesn't mean that you won't be, that it doesn't go away or you won't have it. In the sense of what we're looking at is now really kind of keeping that inflammation dormant, really not doing anything that's going to ignite it, set it off. And again, if you have TENS unit, ice at home, those are some things that you can use to kind of go ahead and decrease the inflammation if you're not somebody who wants to take medication. But like I said, always, if you aren't sure about exactly what it is you should be doing, what I recommend you doing is just book the consult with me. Take advantage of a free consult, no obligation. Let me see if this is actually a condition that you may have or if it is actually something else. And again, like I said, the initial stages when something like this sets in, you do want to do the rest, the ice, the ibuprofen, or the anti-inflammatory, or if it's so severe, see your physician, take that muscle relaxant if you need to. But again, after that, you do want to go ahead, break down the soft tissue, knowing how to use your foam roller, the massage ball, maybe even getting a massage as well. And then from there, maybe using a TENS unit or an electric stim unit, depending on what you have access to, if you are seeing somebody locally, and then getting proper care and proper adjustments by your local chiropractic physician. So guys, like I said, this was just a general overview of what sacroiliitis is and why you might be more prone to it. Now, again, if you're looking to kind of understand how to really keep it more dormant, like I said, book that call with me. Check out some of the core exercises on here, because they will kind of go through step by step what to do from the initial set of onset all the way through. So the five basic core exercises is a great video to start to do once your sacroiliitis has kind of gone ahead and deteriorated down to a very small level of discomfort. All right, everyone, this is Dr. Heather, and if you found some value in this little video on sacroiliitis, give it a thumbs up. And as always, if you haven't subscribed to the channel, please subscribe today. All right, everyone, I'll catch you in the next video.